The GNA, Vital Support to Nursing Assessment. This program was made possible by a grant to the Beacon Institute from the Office of Healthcare Quality. The objectives for this presentation are to enable you to describe the nursing process and why it is important, describe the GNA's role in supporting the nursing process, discuss how observing is different from seeing and hearing, list at least 10 signs and symptoms that the GNA can observe during routine care, describe at least 3 unusual events that should be reported, identify 2 methods to communicate observations, describe at least 3 basic principles of reporting and recording, discuss at least 2 points to consider when recording information, and list at least 3 reasons why documentation is important. Professional nursing depends on a process that offers an organized way to deliver care. It is called the nursing process and consists of several parts: assessment, nursing diagnosis, planning, implementation, and evaluation. Assessment involves the collection of information to learn about various aspects of an individual in order to determine needs and strengths. A good assessment is the foundation for everything else we do to meet that person's needs. Once information is collected, it is analyzed to determine the nursing diagnosis, which is a problem statement based on the nurse's judgment. Then a care plan is developed to identify desired goals and actions to meet those goals. Implementation occurs when the members of the care team actually carry out the plan. Then outcomes are evaluated to determine whether or not the person met the desired goals. If not, the plan needs to be revised in a continued effort to reach the goals. You probably are aware that the nursing home has surveys. These surveys, or government inspections, are done to make sure that the nursing home is following regulations. There are federal regulations and additional state regulations. Basically, federal regulations require that we help residents get better or stay the same. Residents cannot show decline unless we can prove that the decline is clinically unavoidable. Maryland regulations also require the same, with an additional requirement that the feds don't have, and that is to be on a daily watch for a change of condition. Applying the nursing process to determine the reason for the change of condition and designing and implementing a plan to address that change is important to help the person get back to baseline or to show that any decline was clinically unavoidable. Of all the people on the care team, the GNA is in the best position to observe and identify the condition of the resident, as the GNA is closest to the resident on a daily basis. You truly are the eyes and ears to help the nurse perform his or her duties to assure that the facility is meeting the regulatory requirements and providing the best for the resident. Observation skills are essential, as well as how you communicate those observations through reporting and recording. We function with our eyes and ears open, but we may not always pay attention to what we are taking in. Close your eyes for a moment and think about the picture you just saw on the screen. What color was the woman's hood? How many birds were in the picture? How many buttons did you see on the woman's jacket? Now open your eyes and see if you were able to remember that her hood was gray, 2 birds were flying, and there was 1 button you could see on her jacket. Sometimes we can see or hear something without really absorbing the information. But when we observe something, we are paying close attention to the things our senses are experiencing. When we observe, we are not just looking at something, we are using other senses as well: hearing, touch, and smell. When you see a resident with new signs and symptoms, or a resident reports new signs and symptoms to you, find out as many details as you can. This is important information to help identify what might be going on with the resident. Keep in mind that signs are something you can see and measure, such as redness, fever, bruises, or extreme drowsiness. Symptoms are those things the resident describes to you, such as pain, dizziness, or fatigue. When signs and symptoms are present, it's important to find out how long they have been present, the resident's description, characteristics such as constant non-productive cough or dark amber urine with strong odor, the known cause, how it affects the resident, and what makes it better or worse. During your routine interaction with the resident, pay attention to anything that seems different or gives you concern, such as a change in mental status, slurred speech, difficulty breathing or chest pain, facial drooping, restlessness, or any new complaints or symptoms. During your daily routine, you have opportunities to make significant observations about the resident's condition. Give some thought to the types of observations you can make during routine bathing, dressing, hair and nail care, mouth care, mealtime, times when the resident is transferring and ambulating, during toileting, when obtaining weights and vital signs, and throughout daily activity. You probably are able to make more observations during these times than you give yourself credit for. Unusual events require special attention. Report them right away. Find out and/or provide to the nurse as much information as you can. With the fall, how was the resident found? What had the resident been doing or trying to do? Look at the environment. What clues are there? Was the resident not using a walker? Was the lighting poor, a slippery floor, some obstacle, an overturned chair? With skin tears or injuries, do you know how it happened? Does the resident know how it happened? Look at the environment for clues as to cause. When there is suspected or actual abuse, what happened? When did it happen? Who was involved? What was going on at the time? Is there physical evidence? If it is suspected, what did the resident say, do, or what signs did you see that caused you concern? The toolkit accompanying this program has a handout that shows some of the major observations you can make. Don't forget about things you notice in the environment. These things can negatively impact resident care in that they pose potential problems related to safety and infection control. These can include broken equipment or furnishings, soiled items, burned out lights, uneven surfaces, leaking faucets or pipes, pests, and odors. Both reporting, the verbal communication of what you did or observed, and recording, the written communication of actions or observations, are necessary. There are some principles of reporting and recording that are important to remember. Know your responsibilities, such as the documentation that is required. Remember, the record is a legal document. When documenting, write legibly, include the date and time, show your full signature and title, use correct spelling and accepted abbreviations, do not scratch, erase, or use whiteout, and be objective. When documenting on the computer with an electronic medical record, follow the login, logout policies and complete all items as indicated. Chart only after giving care. Maintain the confidentiality of the record. Do not chart for a coworker. When giving verbal reports, report new signs and symptoms when detected. Report any noted change in function. Report behavioral difficulties. When recording, ask yourself, is it complete? Is it accurate? Has there been a change? And if so, report the change. Documentation is often seen as a nuisance task, but it's extremely important. You have heard the statement, I'm sure, if it wasn't documented, it wasn't done. Think about the impact of that with the reasons given here as to why documentation is important, which include to coordinate care, to give evidence of care given, to obtain payment, to protect the facility, and to assess quality. GNA is a vital member of the healthcare team. GNA observations, reports, and documentation are critical to good care and safety in the workplace. Thank you for all you do in your important role of GNA. If you have any questions about this presentation, please discuss them with your staff development instructor or charge nurse. Thanks again.